Welcome to another episode of the Chiro Hustle podcast. I've had such a good time talking to Cliff Tao that I had a tongue twister opening up today. So this is episode 277. And Cliff, I'm really happy to have you again.
Oh, I'm happy to be here. Thanks, Jim, and thanks, Luke, for having me again. Yeah. You guys are great, by the way. You did get another eye roll, I think, out of Luke just now. So I'm going to count them. That's one right there.
All right. So tell us what's changed or improved or has been different since the last time we've interviewed you.
So I think it's been a little over a year since we had our first interview and my, virgin newbie Zoom experience. And, off the air just now before we got started, I said, I've upgraded my equipment. So I have a nice HD camera now. I have some better audio. So hopefully people can hear me a little bit better and more clearly. But in addition to that, at the beginning of this pandemic thing, I didn't know what was going to go on, and our practice went down like 50% for a couple months, and I was like, probably should start doing something. But I don't think I did much. But now we're back up at 100%, or maybe even more, maybe 110, 120% right now. So that's been significant for us, just in terms of being able to handle the increased volume that we see in our practice. So just, hiring a couple more people here and there and tightening up our processes. And that's about it. We haven't had to do a whole lot of weird, like, sanitation type measures, because this is my office at home, by the way. So nobody comes here except for me, the wife, and our 5-year-old. So and our in-laws, which are visiting this week. But that's about it. Yeah.
So in the last year, of all the things that maybe have not gone how you expected them to go, what are some of the takeaways or lessons you've learned from everything that's gone on?
Oh, one of the biggest things is, as chiropractors, we are dedicated, man. I mean, I remember in the beginning, it probably doesn't sound very good, but when they're trying to decide who should stay open, who should not stay open, and I don't know, we were a little bit scared of this crazy virus, like we thought it was like Ebola or something. And I was like, maybe we're not, essential people. maybe we should like close or something. And thankfully, no one liked my idea, because they stayed open and that helped not only helped my business, but I think it helped a lot of people stay healthy and help them free from this virus or whatever. And so I was like, wow, these chiros, I'm a chiro, but I'm not really in the same scenario, but man, these guys are relentless. They're dedicated. They want to serve the masses, no matter what people say, and for good reason, right? But I just, it was at a level that I didn't anticipate. So it's a good thing.
So I want to jump in for a little bit, and you have this really interesting acronym after your name. And you said you work with XRays and you're a chiropractor, but you don't have like a regular like practice. So tell people about your practice and what you do and how you actually support the amazing profession of chiropractic as an X-ray specialist.
Oh, yeah. Thanks, Jim. So I'm a chiropractor. I went to chiropractic school, and then I did a radiology residency for chiropractors. It's 3 years. Some programs are 4 years, but mine was 3 years at the time. And so now I just read X-rays and other types of imaging for my colleagues. So my service is to chiropractors, and I kind of feel like, that way I can kind of reach more patients, right? Because I can read a bunch of X-rays for a chiropractor and kind of serve more people indirectly that way. And I don't know if you guys know this, but radiology is kind of like one of those industries where it attracts certain personalities. And I don't think I'm the typical personality, but a lot of the radiologists are like these hermits or these recluses. We like to stay in our home in the basement kind of thing, in a dark room. We don't need to talk to anybody. Maybe every once in a while we'll talk to someone. But it in one way it did fit me well, because it was very, I don't want to say painful, but it was a challenge to speak to regular patients. Not all of them, but there's always one of them that will just tuck your ear off for non-related reasons. And I'm a very efficient guy. If I'm in there just to adjust T4, that's all I want to do. I want to get in, do it, and get out. I don't want to be talking to you for like half an hour. Unless you're going to pay me, then maybe I'll stick around. But yeah, so that just, I was like, I can't do this all day. So I'm like, I think I'm going to do radiology. And so that's what I do now. I love talking to Chiro, because I can speak my own language and they'll understand me. We don't even take X-rays. If a regular patient came to us and said, "Hey, can you read our X-rays?" I'd be like, "We can, but you got to go through your chiropractor." So I think that forces them to go, or not forces, but kind of encourages them to go to see their chiro in person, so they can get the appropriate care, and then that way I can talk to the chiro about the X-rays. I don't have to talk to them. So that was probably a longer answer than
no. I like where you're going with that. But I know that right now that X-ray is one of those things that's really important to the diagnosis and the care of patient care. And I know that there's provinces in Canada that right now are like under fire for like wanting to like have the best tools and resources to take care of their clients or patients. And I think that that's a big concern. It's like, okay, here we go. Here's a cool industry that's doing great work and keeping people healthy, but let's start taking away something that obviously has a diagnostic approach, but also a treatment protocol approach. So, it helps with contraindication of adjusting and makes it a much more safer approach to practicing chiropractic. So what's your position on all that?
Oh, that was the big question, I think, right, that you're talking about earlier.
Yeah.
So yeah, so I'm pretty aware of, or at least I think I'm pretty aware of what's going up there in Canada. And so I wouldn't say they're taking the right to take X-rays away. They're just limiting the reasons why you can take an X-ray. So so that, just to be clear, they're not removing our privilege or right, or whatever you want to call it, to order or take X-rays. It's more to they want a better reason to take these X-rays. So I think there's two main things to take away. One is that I think that the general public and I think some parts of our profession still believe that X-rays are harmful overall, and they are, but they're not as harmful as we once were led to believe. And this is because of a lot of data that's come out in the past 10, even 20 years now. It's showing that it's not as harmful as we thought it would be. There's for one, there hasn't been any hereditary harmful effects from getting X-rays done, even on kids. So so that's one thing. So I'm not saying there's no harm involved with X-ray, and we still have to have some type of thought process involved when we're going to take them or order the X-rays, but they're not as harmful as we once thought them to be. And then so that's one thing. So it's so that opens the door a little bit. We shouldn't be so fearful when ordering X-rays. Other things, maybe CTs, those have more ionizing radiation. They're probably produce more harmful effects later down in your life. Okay, so you need a higher threshold before you order those things. CBCTs, you probably heard of those too. A lot of the upper cervical guys use that. That is not a lot of ionizing radiation. It's more than regular X-ray, but it's not like it's a CT scan. So, okay, you need a little bit more thought process before you order one of those. But still, I think a lot of people think that, oh, once you get an X-ray or once you get a CT scan, you're going to get cancer. It's not like that. Like, there's more people that will get it, maybe, 20, 30 years down the road or something, but it's not everyone. And you're not going to grow an extra leg or arm or head or something like that. That's never been shown, at least not that I know of. So there's that. So there's the not as harmful effective X-rays. And then I think the second thing that I think people don't realize, or maybe they don't, not that they don't realize, but they're reluctant to realize, is that it helps the people that are ordering X-rays for, quote unquote, non-legitimate reasons are actually getting people better because of the X-ray. They use the X-ray to, like you say, it rules out certain things that would be a contraindication to adjusting, but it also helps them determine how they're going to adjust. I don't know the specifics, but maybe what angle or what joints to adjust, or which ones not to adjust. So I think it affects the clinical outcome. So in those patients, I think they get better because they did take the X-ray, and you've also avoided potential complication from adjusting somewhere or someone that probably should not be adjusted. So I don't know what the why those people think in that way. That seems pretty factual to me. Most of the evidence is pointing in that direction. I don't think it's, a black and white issue. I think there's still some gray area in there, but I think we can, let up our fears of radiation a little bit. And I think we can be a little bit more open to the good that X-rays in particular can do in terms of helping people get a little bit better.
Well, two things I always want to touch on with you on what you shared is seeing is knowing, and you don't want to, guess with people's health. And if you have access to something that can make the care more effective with better outcomes, it all adds up into better clinical excellence and more objectivity for the person that is receiving care, and a better case proposal that we actually took you in and did a proper assessment, analysis, and a treatment protocol and got you better. And I think that when you think about life in those terms, like if you said, hey, we're not going to take X-rays, but you could have like a fracture in your spine, or you could have some ligament damage, but you're fine. We're just going to adjust you. Like, no, that's like a red flag. Or if you're like, hey, by the way, we have like this state-of-the-art X-ray equipment that's really low radiation that can help us with any contraindication to show if there's any, micro tears or any instability or any type of fractures in the osseous formation, which is your spine. So we want to be like really cautious and use the tools that we have in order to give you the best care possible. And by the way, in like X amount of visits, we're going to re-X-ray you and show you how we've actually helped restore cervical curve or lordosis or whatever the languaging is. And we're going to show you that because you accepted care and we imaged, and now we're going to re-image, we're showing you that your body's actually doing what it's supposed to, is heal under our care and our protocols. So I think when you're talking about like, the safety effect, well, there's also a double level of safety, as we want to make sure that we're providing the best care possible to people to assure that their body is going to be able to, number one, take a chiropractic adjustment, but number two, sustain itself and repair. So I think there's a lot of validation in this whole X-ray talk. So thanks for sharing your knowledge on the topics as well.
Yeah, no problem. One extra point, I'm not sure what the data is for repeated X-rays. Like you mentioned, you could take say after a couple months or a few months, take another X-ray just to make sure, the lordosis is getting better, or if it's, hopefully it's not getting worse. I'm not sure what about that. If we should do one, I think maybe, I don't know. That's just how I feel. Probably one is okay after a couple months or a few months. In the routine process, even if they're getting better. I don't know if they should, the question might be, how often should we take these recheck type of X-rays, every every month or every 3 months, every 6 months, every year. I don't know. So that part is a little bit gray. I agree. I don't know what the answer is, but I think it's probably pretty reasonable to do at least one, just to make sure everything's hunky dory, and then okay, yeah, everything's good. Your lordosis is getting better, or your scoliosis is getting straighter. We're good. We're good to go. We keep doing the same thing. So.
Well, hypothetically, if they do start taking X-ray away, not just in Canada, but globally, if chiropractors can't X-ray anymore, how do you think that would change the future of the profession?
Oh, it would drastically change the future of our profession. I think we would be able to adapt. If we were constrained to, no X-rays, then okay, then So there's a couple different options. I mean, you could send your patients somewhere else to get an X-ray, for quote unquote more legitimate X-rays. But those are challenging options too, because then you're sending it to a medical facility. They're probably not taking it the way you want them. Like, for example, a lot of medical facilities take them, lying down. I'm like, well, that's, not really a true postural assessment. So, just little things like that, we could probably get around it, but it's not going to be easy. And there are other types of imaging on the horizon that are very, very low dose, like even lower than regular X-ray. So maybe that would be an option later down the road. Who knows? It would definitely change for me. If I had no more X-rays to read, I don't know what I'm going to do. I'll probably just retire or something. Maybe I'll be a podcaster like you guys, and or you can hire me.
We'll bring you on to Chiro Hustle, no problem.
All right, cool.
Well, changing gears a little bit, who have been some of your mentors or inspirations to help guide you to where you are today?
There's a lot. I like to take snippets from everyone because, kind of like I mentioned before, I think everyone has some good qualities. Everyone in the world has at least one really good quality that I think we can take away. Some people have bad qualities, so I try not to take those. But so just off the top of my head, just professionally speaking, probably the most well-known chiropractic radiologist is Terry Yoakum. He wrote this book that everyone uses, and so not only from a clinical perspective where he's good at looking and like interpreting X-rays, but his business sense. He gets out there, he speaks, is very bold and confident. I don't have any of those types of personalities, but I could kind of make it up as I go along, or maybe kind of work on it as I grow, kind of thing. So he's been one. Someone else that pops into my head is the president of Sherman, actually, Edwin Cordero. I met him just a couple times, and I see how he is online and stuff like that, and I'm sure you've met him too. But what a nice guy! Just someone who's at I feel like at such a high level. Not that they have a right to be condescending or kind of top down type of approach, but he seemed just very relatable. Like, it's very easy to talk to. He was very welcoming. Just in the few minutes that I spoke with him a couple times, and I was like, wow, he's just and it wasn't just him, but his leadership style, I think influences all of Sherman. And I spoke to multiple people at that school, and I was like, wow, what just a nice environment to work in. I'm not used to that, at least in my experience. So that's something that kind of I like to take away. Just it doesn't sound like much, but just being nice and relatable, welcoming.
Edwin's very down to earth.
Yeah, right. I'm like, I need to be more down to earth. I'm not, Alien. There's that Alien reference again. Maybe had never been down to earth. So yeah, I loved my time there. I was there maybe a year ago, or maybe it's been 2 years ago now, for their Lyceum. So I'll be there again in the fall. But yeah, I look forward to being there and hanging out with those people.
Well, being in the X-ray and radiology world, are there any like scientist mentors you look up to?
Oh, well, kind of, the guy that started it all is Dr. Rankin. So he's the guy that uh, Willem Rankin, German guy. He like just discovered X-rays by accident. I'm sure you've seen it. There's like an X-ray of his wife's hand that's like super blurry with a ring on it. Which, by the way, it took like at least 30 minutes to produce that one image. So it's like a blasting of X-rays all over. And so, by the way, did you know that? So there's this other lady, Mary Curie. She was involved early on. I don't remember exactly how, but in the discovery of X-rays as well. But at that time, no one knew their harmful effects of X-rays. So she got blasted herself with just I don't know how many photons of X-rays. But so in her tomb, or maybe it's a sarcophagus, I don't know. Like it's like a coffin that you can see. It's not underground. But I just saw a post, and I think I've seen it before. But her sarcophagus is lined with like an inch of lead, because to this day she's still like emanating radiation from her body, and because the sarcophagus is in plain public view and people can kind of walk up to it, they had to line it with lead.
She's like Chernobyl.
Yeah,
I knew we were going to go nuclear on this episode, but I didn't know when.
There you go, right
heard
there.
Of either of those people, I got to look them up.
Oh, it's fascinating. So yeah, Rankin was the guy that started imaging with X-ray, and then after X-ray came like CTs and ultrasound and MRI, and those are kind of all under my purview of imaging.
Wow. So if you could pick any one person from history to have dinner with, who would you pick?
Someone from history that is not alive now that I could have dinner with. Oh, there's so many.
Be alive for dinner.
They could still be alive, okay?
They can still be alive for dinner, and we can chat.
We don't have to go coffin knocking.
I'm gonna have to say, this is gonna maybe disappoint some of my people, but D.D. Palmer. Like, I don't know if we would get along, but I'm constantly fascinated by just the philosophy, or maybe not even philosophy, but just the thought process and the mindset of how we got it started. What was he feeling at the time? Stuff like that. Like, you just kind of break into his mind and see what was going on and how he came up with this stuff.
Well, I think the thing that you're touching on there is like, I'm sure Didi was a tough old man. Like you look at pictures of him, you're like, I don't want to mess with that guy.
Yeah. But dinner, maybe I can handle dinner. Sitting across from him, but you can't touch me. Yeah, him or BJ. But because if I'm gonna pick one, I'll pick Didi.
So if you had to pick one thing about yourself to improve, what would you pick and why?
Oh man, I know what it is exactly, and we talked about it before off air. It's and we touched upon it already. It really is being more down to earth and being more loving. It's I think it comes naturally to some people, and I think it should come naturally to everyone, but it does not come naturally to me. I'm not a touchy-feely type of person. I admire those that can do it so flowingly and naturally, but it doesn't come naturally to me. And we mentioned it before. Like my wife loves it when I'm, all emotional and feely and. Before we met, I'd be like, no, feelings have like no place in my life. They interrupt my workflow. They, makes everything. It's just an inefficient process in my workday. So I don't allow time for or any room for feelings in my, at least professionally, but it, kind of bleeds into my personal life. So, but it's like it's opened this new dimension to me that I never thought existed. I don't know why, but I blame my parents. That's what it is. They were that's what it is. I blame them for
Here's the
everything.
easy answer.
Well, I'll tell
Yes.
you, Cliff, like our pre-interview chat, something that you do have in excess is good sense of humor. So I think that that's also really comforting to have from somebody. Is I'm sure you make your wife laugh a lot, even though you don't bring a lot of emotional draw to that. I do like your dry sense of humor.
Thanks. And I think you like it better than my wife, by the way. So I appreciate that.
I'm taking that one.
Yeah.
That's going to be your poll quote.
I blame my parents.
Do it.
So what would be some advice you'd give to another chiropractor who wants to make more of an impact on their community?
Oh, the audience for Chiros versus the audience for me is limitless, I think. They say, we serve maybe 10% of the population. I've seen it go lower and higher, but, about 10%. So to me, that means, we have 90% left to get into our offices, or at least to spread the word about chiropractic. So just to get out there, if it's uncomfortable for you to talk to people, talk one-on-one or one-on-two or whatever, find a way that, you can get the message out for chiropractic, or even if, just your own office, that's the biggest thing, I think, for in terms of an impact in your community. And, for Chiros, I think, we're typically, we just serve within, I don't know, maybe a 10-mile radius of the office, because, people have to come in and get adjusted. So it's very easy to get known. I think, I don't know, maybe it's hard for some, probably is harder for some than others, but I think it's just getting out there, maybe get a little bit out of your comfort zone. I'm not a big fan of getting that far out of your comfort zone. I'm a strong believer in that you have to, challenge yourself and do something that's fearful every once in a while, with the intention of it being a good goal in the end. But I think that's it. It's just pushing yourself just a little bit. And whether that means, having a mentor or a coach or whatever to kind of facilitate that or help you get there, then, whatever way you need to get there to push yourself just a little bit more. I think that's the key.
That's
and,
good advice.
I believe the human potential. I mean, you guys talk about it. I've seen other chiros talk about it. I think it's absolutely true. We're, well, I should back it up a little bit. I know you guys, I've mentioned this before, but I hate anything that's inefficient, like anything that just slows me down, decreases the quality of my work. I hate it. So one example of something that I absolutely love, because it's like in my moral fiber, is intermittent fasting. It's, it's healthy, it helps maintain your weight. I love that I can work an extra 30 minutes or an hour per day. And it's cheaper, I save money in the end. So it's like all these things, these are like three key things: healthy, efficiency, and saving money. Those are like the three big things in my life that I strive to optimize. And intermittent fasting does all three at the same time. So I love it. Now I don't remember what we were talking about. We were talking about
Words of advice for other
oh
doctors.
yeah. So yeah, just human potential, right? We all have a potential that I think is greater than what we can imagine. But we can only get there by trials and tribulations and, challenging ourselves, push yourself just a little bit more, a little bit outside our envelope, a little bit outside of our box of comfortableness to get there. It's, I don't know. I'm constantly amazed by the human body, if not just physically. Now, I see the emotional component is just, it's amazing. So we can do a lot more, I think, than most of us can imagine. And all it takes maybe is just a little bit push in the right direction.
Well, all right. That's pretty much the end of our questions. But is there anything that we didn't ask you that you wanted to talk about?
Anything. Oh, I know. I don't know if this is okay. Why are you laughing, Jim? Like things just randomly pop into my head. So you guys know, I love the outdoors. I particularly love skiing.
Mhm.
And in the vein of efficiency, it was very hard to ski for fun because it takes a lot of time and it's very expensive, and do what I love professionally, which is, read X-rays and stuff like that. So I merged the two, and I do like a ski seminar at Mammoth Mountain every year. So I'm just getting, inking the deal now, trying to get the rooms and stuff ready. So if it's okay, I'd like to promote that.
Plug away.
Please do.
Oh, okay. It's April 1, 2, and 3 in Mammoth Mountain. We're going to have a few different speakers. It'll be 12 hours of CE approved for California. But the big thing is we have no formal classes or education between 9 a.m. and 4 p.m. because my goal for doing this is so we can ski. I've been doing it for 6 or 7 years, and yeah, we have classes early in the morning, and we have classes after we get back from skiing. There's food, and it's a small group. We usually have 20, 25 guys and gals out. So if you ski, you like chiropractic, you want to learn a couple things, and mark that on your calendar, April 1, 2, 3 next year at Mammoth Mountain.
Where do they register?
I don't know. I don't have that. I don't have it open yet.
CliffTao.com.
You gotta have a website.
They can go to my website, but I don't have the registration open. They can contact me actually, because it's so low volume. I don't anticipate there being that many people, but they can contact me to register. But I don't even have the fees or anything set up yet. It's usually about I don't even know how much it is. I want to say it's about $400 or $500 to register. It's 12 hours of CE, includes food, but it doesn't include anything else. We don't pay for your lodging, lift ticket, or anything like that.
Well, just for fun, what are some of your websites where people can learn more about you?
Oh, so I have my website. It's Cliff Tao D.C. DACBR.com, and they can find me also on Facebook. Using the same, they can search for Cliff Tao D.C. DACBR, and same thing on LinkedIn.
Well, Cliff, another dynamic episode with you. Thank you for being our guest today, and the information you shared is priceless to people. And I appreciate you being episode 277 with us. And the connection is real, and I'm really excited that you were able to so eloquently and by standardization tell people that X-rays aren't that challenging for them, like health wise, and that it's probably a good thing for people to continue doing them, so we don't have to pivot out of what's going well for chiropractic and try to go a different route. So your knowledge is priceless, and thank you for sharing.
Oh, thanks for having me. It's been a pleasure, and it's always fun chatting with you guys.
Yeah, thanks for being our guest today, and we'll have to bring you on for a third one.
A third one? Oh man, I'll have to come up with more jokes.
Yeah, you will.
We'll actually do it in anticipation of promotion for your ski event.
All right, sure. Yeah, love to do it.
We'll just
Thanks,
talk
man.
about skiing the whole time.
Oh yeah, I could talk about it all day. Hey, we should do it while I'm skiing. That would be amazing. Or while I'm on a hike or a bike or something. That would be cool.
We can make it happen.
All right.
All right, Dr. Cliff, thank you so much for entertaining and enlightening our guests once again. And we just want you to enjoy the rest of your afternoon in sunny California.
I will. You enjoy your great day in Colorado too. And thank you again, Luke and Jim. It's been great. Thank you.
Until next time, my friend.
We'll see you.